Good morning. I'm going to do an incentive spirometry. So the first thing I'm going to do is check the patient's chart, and then what I'm going to do is look for if they're on any pain medications, and then I'm also going to look if they're going to be a post-op patient, and if they are going into surgery, kind of instruct them before they go. That way they know they're going to be doing some exercises with their lungs after surgery. So the first thing I'm going to do is I'm going to knock on the patient's door, introduce myself. I'm going to check the patient's ID band, and then I'm going to wash my hands, and then I'm going to apply the appropriate PPE. So I'm going to just apply on gloves since we're just going to do a volumetric exerciser. So that's just involving patients exercising their lungs and trying to strengthen them to cough up anything. So I'm going to check the patient. I'm going to listen to their lung sounds, and I'm going to check their vital signs before we begin. So when I'm ready, I'm going to instruct the patient on what we're doing. So here's a volumetric exerciser. So this is going to help you strengthen your lungs, to expand your lungs and help them be able to get the deepest inspiration that you can to clear out any secretions, anything that can cause atelectasis, anything like that. It'll improve your breath sounds every time. So every machine here comes with a chart. So here for me, so you look at the height and you look at the age. So I'm going to be between 1900 and 1850, around there. And so then I'm going to prepare the machine. So every machine here, before we use it, we always inspect it, make sure there's no cracks or anything. If there's any cracks, then we will replace it. And so I will set it at the appropriate area. So you just move this yellow tab, and that kind of gives me an idea of like where they're at when this white thing, the white piston here, goes up. And so I will set the patient up. After I have the machine set up, I'm going to set the patient up, position them to where they're comfortable, and if they are post-op, I can have them hold on to a pillow. If they feel like there's any discomfort for them, they can hold a pillow. That way it makes it a little more easier on them. Then I will set them up to where I can have like either a table or something where they can hold on to the machine if they'd like to hold on to it. So the machine has to be sitting like this. So I'm going to set the tubing in there for them and show them how to put it in there. And then I'm going to go ahead and instruct the patient. So here we have the volumetric exerciser. So here what we're going to do first is what I'm going to have you do is take a nice deep breath in, and then exhale. When you exhale, I want you to exhale all the air that you can feel in your lungs out. And so when you feel that all the air is out, then when you go to take a breath in again, I'm going to have you place your mouth around the mouthpiece, place your tongue underneath the mouthpiece so you don't occlude the mouthpiece. And so and then you'll breathe in and take a nice deep breath in, and I'm going to have you hold it for 3 to 5 seconds. If you can't quite get that 3 to 5 seconds, that's okay. We'll continue to practice and strengthen up your lungs. So when I'm ready, I'm going to have him take a nice deep breath in, and then exhale, and then inhale. And then when I have them exhale, I will have them exhale away from the mouthpiece so that way they don't get any moisture into the machine, and that way they don't mess up anything and they just exhale away from the mouthpiece. So when I'm done, I'll instruct the patient that they need to do it at least 6 to 10 times per hour, but if they can't quite do that many, then I'll just start them out at like at least 5 or something like that, just to start them out with in an hour. They get them practicing on it. So if they have to practice it again, I'll set it next to their bedside. I will remove this though, keep this mouthpiece off to the side. If they are done using the mouthpiece, you can wash it with sterile water and air dry it. So you just set that in the side. You can set it on a towel, anything like that to keep it sanitary. And then at the bottom of this machine, you can put the patient's name, patient's room number, and the date that you gave them the machine. Then you can just set that next to their bedside. And then when I'm done with them doing the treatment, then I'll go reassess the patient to make sure their lung sounds are improving with this treatment and that their vital signs are still doing okay. And so when I'm done, I would remove my PPE, and then I'd dispose of it in the appropriate bin, and then I'd wash my hands, and then I'd go and make sure the patient is repositioned where they need to be and where they feel comfortable, and then I'd go and chart on the patient's chart to let the doctors know.